Hi, it's Dr. Murray doing a little presentation for you today on thyroid hormone, the kind of conversation that I provide to patients here just in my room. This is where I give my consultations, and talking about thyroid function and the importance of having thorough and accurate testing. So the first thing we're going to look at here is just how thyroid production, how it works in your body, just generally speaking, and how your brain actually kind of corresponds or acts in response to it. So let's just first draw a little picture of a man or woman, and we're going to draw a picture of the pituitary in here, and so there's a real nice looking person here. In your brain, you have this thing called the pituitary, in particular the anterior pituitary, the front portion of it, and it creates this stuff called thyroid stimulating hormone. Thyroid stimulating hormone is produced by the pituitary in response to thyroid hormone that is produced throughout your entire body, T4 and T3. If you take synthetic thyroid hormone, primarily it's going to be like levothyroxine, and that's synthetic T4. Well, whatever's produced in your thyroid, which is whatever's produced in terms of T4 and is converted into T3, any of those hormones that come back up to the brain corresponds by asking the question, is there enough thyroid hormone here? Is there enough thyroid hormone being produced by the thyroid and actually being converted in the rest of the body to let me know that there's enough hormone here? And if there's not, the pituitary is going to make a lot more of thyroid stimulating hormone in response to lower levels of thyroid hormone. That thyroid hormone then is going to come down to the thyroid and kind of knock on the thyroid and say, hey, thyroid, wake up, make me some more thyroid hormone. So with those folks that tend to have lower T4 and lower T3, those numbers, primarily you would expect to see a higher TSH. And that's why when people have hypothyroidism, they're normally going to have higher TSH. But remember this, that thyroid stimulating hormone is not a thyroid hormone. It's a brain hormone, a pituitary hormone. And so if you really want to know what's actually going on with all the hormones, the thyroid hormones, you need to test thyroid hormones. And so testing your T4 and your T3, your free T3 and your free T4, all good ones to test. Around 80% of the time, if your thyroid is not working properly and you're not making enough thyroid hormone, you have some type of an autoimmune condition that is attacking your thyroid. And you can test, for instance, like thyroid peroxidase, autoantibodies, thyroglobulin antibodies, some of those, to actually see if there is actually autoimmunity that's going on with the thyroid. But back over to this area over in here, there is a unique situation that can occur in the conversion of T4 into T3. That's an important process. A lot of people, what they end up happening to them is they end up taking thyroid hormone because they've been hypothyroid. And so their TSH is normal, or their T4 is normal, but they still don't feel great. And they have these numbers tested and they're fine. Well, one of the other problems that can occur is conversion can be off. It's not working correctly, this conversion, which takes place in the kidneys and the liver, the lungs, and different tissue throughout the body. This conversion can be altered by stress, can be altered by anemia, can be altered by different infections. If you are on an island starving to death, the stress of being on that island will cause you to convert your thyroid hormones differently, and you won't make as much of free T3. You will make more of what they call a reverse T3. The high amount of stress of being on that island will cause you to convert your hormones differently so you don't die on the island. Right? So that makes sense. You don't want to die on the island, so your body's going to slow down its metabolism, and you're going to make a high amount of reverse T3, a type of thyroid hormone that blocks the action of T3. What has also been said is that in terms of when you look at reverse T3 versus T3, you want to have around 3 times the amount of T3 as you do reverse T3. Because if you have high amounts of reverse T3, it blocks the action of T3 and it brings down your metabolic function. Now, if you look at your thyroid hormones, that person who's on that island, and you look at their hormones, their TSH and their T4 is going to look normal because they've slowed down their metabolism on purpose. And why have they done that? Because they don't want to starve to death. So that's a normal mechanism, but the reverse T3 would often be high there. Same thing can happen for those who have high stress events in their life. Now, that could be emotional stresses, but that could be physical stresses. This could be deficiencies. This could be anemias. This could be infections. This could be all kinds of different things that are going on in your life. Could cause you to have stress, the stress of life, so to speak, can cause you to convert your thyroid hormones differently, and you start producing a lot of reverse T3, a low metabolic thyroid hormone that puts you into metabolic insufficiency or metabolic syndrome. That's why it's important to have your reverse T3 tested if you're concerned about having thyroid related issues and problems. The last little bit to understand is the why back behind here. If you are taking thyroid medication and maybe you've been taking thyroid medication for years and you're like, well, they can never get it regulated. And maybe it's also partially because of the metabolic syndrome that's being created by the reverse T3. But maybe it's also because the why is not being addressed. This is the why over here. I mean, this is one of the whys if you're metabolic syndrome, right? So dealing with the stresses of life could be deficiencies, could be toxicities, could be emotional stresses, etc. But over here, if you do have autoimmunity, and you are taking thyroid hormone and these numbers are completely normal, if this autoimmunity is still present, it's like you're walking around with the flu all the time. That's why it's important to make sure that you have your autoimmunity checked and actually trying to do something about that as well. So if you do have thyroid autoimmunity, then going after that and trying to down-regulate the inflammatory issues that are going on in that area, which could be related to Epstein-Barr virus or other different stealth infections. Getting to the cause of the condition, getting to the why, and not just taking a pill and being done with it and saying, well, I guess that's it. I've arrived. Because so many people, they take the pill and they've arrived and they're still sick. They still don't feel well. So that's what we do in our office is we test the reverse T3. We look at the antibodies. We look at the stealth infections. So we look at the underlying inflammatory conditions because you always would rather deal with the root causes of conditions than just only, and I'm not saying there's not times for taking medications. There most certainly are reasons for doing that. But you'd like to get to the reason. You'd like to get to the cause. And a lot of times you're taking the medication and you still don't feel right. Get to the cause. Don't just put up with feeling horrible. There's almost always a reason there that you can get to. You just have to find it. Not to test is to guess, but to test is to know. It's Dr. Murray with Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.